Yeah. Good afternoon, ladies and gentlemen, and we welcome you again to the second day of the Monkeypox Sensitzation. Sorry, I'm biting my tongue there. And again, we welcome Dr. Singh to give us some informative, some great information on monkeypox and how we are about to deal with it. Especially for us here in the ports, we need to know what is coming in and how to manage the situation as it lose to us. So again, welcome, Dr. Singh, and we will get straight to it.
Thank you. Good afternoon, ladies and gentlemen. And along with me, Port Health Senior Nurse Sister Cumberbatch is there, and our records of auditor clerk is there. You know, Sister Brathwaite is also here. Okay, good. So you know very well about the monkeypox problems now is a whole world, right? Okay, so that's why just we are bring the monkeypox sensitizations, and if you have any later on doubts or clarification, we are ready to clarify. Right? So the main objective is after this presentation, you should be able to understand what is monkeypox and describe the evolving of current monkeypox epidemic, state the possible local impacts of such an infection, outline the recommended and responses. So what is monkeypox? Classically, a zoonosis endemic to West and Central Africa since 1970s. Animal host, generally it will spread from rodents and other animals, including monkeys. Traditionally from animal to human or limited family group outbreaks. Reporting rate apparently increasing since the cessation of smallpox vaccine in 1980s. I don't know how many of you had the smallpox vaccination. You all had the vaccination? Okay, good. So the cessation of the smallpox vaccination, so apparently increasing some of the monkeypox. And the exported infected animals caused outbreak in United States in 2003. Human to human outbreaks, that is in United States, UK, Israel, sea via infected travelers since 2017. In 2017 to present, Nigeria outbreak was more than 500 persons. In May 2022, present multi-country outbreak is a non-endemic country, including Barbados also. So this is the monkeypox virus envelope. Oh. This is a classical monkeypox stage. So these are all the 4 stages they mention about in the WHO. So what are the 4 stages? One is a timeline, clinical findings, infectivity. If you see that incubation period, that is 5 to 21 days. So once the person got infected, the incubation period takes nearly 4 weeks, okay? After 4 weeks only, then the stages will come. So after the incubation period, fever stage, that is 1 to 4 days. Next stage is a rash stage. Rash stage is 2 to 4 weeks. Then recovery phase, that is days to weeks. Some people will get fast, some people will get a little bit longer to recovery phase. So what are the clinical findings? The clinical findings, nothing, lymphadenopathy near end. So then if you go to the rash stage, macule, papule, vesicule, and pustule. These are all the 3 things. It will start from the skin rash. We'll show you that how it is coming in the next slide. And then finally recovery phase, crusted, and the healing phase is taking place. Infectivity during incubation period, no infectivity at all. Fever stage, yes, very low infectivity. But at the same time, rash stage, it is very, very high infectivity that takes place. So recovery phase, after the crust and everything formed, everything is fine. Then recovery phase, no infection at all. So that means during the incubation period is a no infectivity. After the recovery phase is a no infectivity. So here we can see in the monkeypox, in London, the 7th of May, female returned from Nigeria. Then in 14th of May, family of 3, no traveler or linked to the case 1. So the first case on the 7th May, in the same family on 14th May, 3 people were infected. On 16th May, 4 men who self-identify MSM, that is MSM is men sexually with men, unlinked to each other previous cases. That is on the 16th May. On the 18th May, 2 men with the MSM via sexual health clinic, they identified. Again in 21st of May 2022 in London, New South Wales, 11 men unlike to each other, links to London and Spain. On 23rd May in the London, New South Wales, Scotland, more than 32 men linked to London and Spain. So these are all how it has started from 7th May. At the 23rd May, how many people were infected with that, you can understand. So how it is a transmission takes place. Transmission, close contact with the symptomatic, with the lesions, body fluids, respiratory droplets, or contaminated materials such as beddings. Okay, that is a transmission, close contact with the symptomatic people, that is with the lesions, body fluids, respiratory droplets, or contaminated materials such as bedding, or linen, or other things. Contact with the infected animals. If an animal has been infected, rodents or squirrels or monkeys are infected, yes, through them also they will get infection. And also transplacental spread, that is placenta, that is during the time of the pregnancy, and transplacental spread can take place. And the seminal fluid after resolution of lesions. So that is seminal fluid also after resolution of the lesions. Yes, it's a possibility, they say. So this is the monkeypox, you can see. And the first picture, A, B, C, D, E, F, G, H, and you can see that. So the first one is the rash, it is developed. And the second picture, yes, again, the rash is developing up. When you come to the D, you can see that it's a big pox with the pus, that is called pustule stage. And also then you can see the finger, and slowly the resolution is taking place. That means the recovery phase is coming to end again. And monkeypox, what is happening currently in the multi-country outbreak? January 1st to July 22nd, nearly 7,892 confirmed cases. Out of the 3 people died, only 3 people died. In 63 member states, in 5 WHO, that is the World Health Organization regions, 82% in 6,490 cases in 34 countries in the WHO European region. So that means nearly 82% is in the European region. And 15%, 1,184 cases in 14 countries in the WHO Americas region. That means including Barbados. So for 15%. And 2%, 173 cases in 8 countries in the WHO African region. And 1%, 24 cases in 4 countries in the Western Pacific region. And 1% in 15 cases in 3 countries in the Eastern Mediterranean region. And globally, whole world, 78% of cases were males aged 18 to 44 years. 7 children less than 18 years of age in countries in the African and European region. 98% of the cases identified as men who have sex with men, of which 41% are HIV positive. Can you see that? 98% of the whole case in the world identified as men who have sex with a man, MSM, of which 41% of them HIV positive. 47% indicated exposure during social events with sexual contacts. 113 healthcare workers included checking if exposure is occupational. Okay. Monkeypox, non-typical presentation. Few lesions or even a single lesion. Okay, few lesions or even a single lesion. No skin lesion in some cases with anal pain and rectal bleeding. Genital or perineal or perianal area lesions with no spread to rest of the body. Lesions appearing at different stages of development. Lesions before fever, malaise, and other symptomatic symptoms, absence of prodromal period. So these are all the non-typical presentations. These people also finally come as a positive cases too. So now you can see, this is the 4 stages. You can see that day 5 symptoms onset, and the 6th day, there is a small pimple-like structure. On the 7th day, you see that little bit bigger vesicle. And then you can see that the next one is the little more bigger and pustule. And then recovery state is starting in the 11th day afterwards. Okay, that is called crust. Last one is becoming thicker, thinner, and blackish, and crust will develop. So that is the last stage. So conclusion, monkeypox has likely been spreading globally since 2017. Spread can be accelerated in mass events that facilitate close contacts with multiple persons. You have to see that spread can be accelerated in mass events that facilitate close contacts with multiple persons. So we had to be very careful here, and we had to follow the protocols. What are the protocols? As the protocols were the COVID-19, the same protocols we had to follow it here too. One is just to use the mask. Number 2, sanitizers, always sanitize your hands or wash your hands. That is best thing. And also try to be at least for 6 feet is a space that should be given to each person. That is always is best. How it is in the other infectious diseases. Same thing for monkeypox also. We had to do. And the health workers interacting with the infected persons are at risk without standard precaution and use of appropriate PPE. Health workers, any health workers, whether it is a doctor, nurses, or any other person who are dealing with the people with the monkeypox, they are also at risk. So that's why always we'll advise them to use PPE, personal protective equipment. That means it's a mask, and also, if possible, goggles and also gloves. Okay, all those things for the healthcare workers. Non-classical presentations may facilitate non-isolation of infected and infectious persons. So sometimes the non-classical presentation, sometimes it may look, may not look, but we have to take a test and confirm whether it is a monkeypox or not. So that's it. In case if it is a monkeypox, right? So immediately that person will be isolated, whether it is in the working place or any other place. There is a separate isolation, it's a small place isolated. If suppose if you are here, small place is there, we can put one person there until we examine and triage, and we'll take a swab, send it to the lab. So Then we will ask them to stay for a few hours. Once the results come, if a negative, they go home. If it's positive, yes, we can ask the concerned area people, Dr. Corey Ford and the team, or from the Ministry of Health, Chief Medical Officer, Deputy Medical Officer, we will call them and ask them where is this person they are going to put it. We can send them there and they can treat them there in the isolation. After that, they'll come. But at the same time, these are very close contact. If any workers are very, very close contact, we will advise them to monitor because incubation period is nearly 4 weeks. So that's why we'll ask them careful and watch it. If any small pox or pimple-like structure comes or develop with fever, malaise, tired, or lymph gland swelling, so immediately call the healthcare institution, polyclinic, or your healthcare doctors, so they can advise you immediately. But don't go there, okay? From home, wherever you are, just we can call and they will answer you. And they can make a decision where you are going. So that's all. That's very, very simple thing. Because COVID-19, we had a good experience. Same experience we are following here. Okay? So that is no problem at all. So that's why conclusions, monkeypox likely been spreading globally since 2017, but it is a little bit more spread this year. And it is controllable too, but we have to follow the protocol. And healthcare workers, yes, when they are doing the work, and you have to call them, you have the nurse here, nurses are there. If anybody develops with a small rash or anything here in the working place, you can call them, they can answer you. Okay? So non-classical presentation, if any person in your family to develop any small pox-like type or pimple-like rashes, please call them under to the healthcare institution, or if you know the nurses, yes, they can answer you. Okay. So what are the implications? First, you have to be mass gatherings, you have to be very careful. Festivals are possible. Super spreaders will be there. Risk communication for participants needed, right? So mass gatherings, you have to follow protocols. Use masks and also sanitizers. That is very, very important. So next, healthcare workers use standard droplet precautions as warranted. Surveillance at the port and the inland. Always surveillance in the port has been enhanced. Also, first when we get the first case, yes, strengthen in the ports, all the ports, whether it is the airport, seaport, or any other ports or fishing ports, everywhere strengthened. We are strengthening all the people, sensitizing all the people like you all, okay? And if you find out any person has come with a little bit small rash or anything, you can tell them. Sometimes they may not know whether rash is coming or not. Suppose if you see the face or anywhere, yes, you can identify easily. And you can advise them, you have some rash and what is the problem? You have a fever or a cold or you feel like malaise and your tiredness, lethargic. You can ask them to. And if anything is suspicious, you can call immediately in the port nurse or healthcare port nurses also, public side also. Okay, so that is the way they're strengthening. And also the Port Ferdinand and Port St. Charles also strengthened. They are also sensitized. Okay, airport, seaport, and everybody is strengthened. This is one of the sensitization sessions. Okay, so you know what is the implications now. Okay, and assessment of the symptomatic traveler, health alert information. If a person comes, first we'll see that in the port, did you travel anywhere, or you are coming from, if it is an airport, which country you are coming from. So travel information. Once the travel information is there, definitely we can identify easily where he is coming from, what is his background, everything we have to do that. Okay. Inland, index of suspicion for unusual rash. If any person has unusual rash in your family or friends or thing, yes, you can call the healthcare institution, healthcare workers, they can answer you. And history to determine probable case, simple lesions, isolation, contact tracing. Index of suspicion for STI rash. If any sexually transmission infected rash should probably also be tested for monkeypox too. Those are in the MSM groups or any other LGBT groups, if they develop, that is called the STI testing the centers. If they develop anything, rash or anything, they can be immediately tested for monkeypox. Okay. And most probably, this is my last slide. This is given this PAHO. We got it from all the materials, and what we put it on the slide is from the PAHO and Bagani and also TAN. So these are all the researchers. They did the research and find it out. So here, take-home message is, first, you have to understand what is the signs and symptoms. So signs and symptoms is a rash, okay? Rash with the fever, anybody develops headache, or if a person develops with anything is a lethargy or gland swelling, if you could see 1 or 2 poxes too, not multiple poxes. If you identify any 1 or 2 poxes, yes, you can call the healthcare workers. And 4 stages you have to identify. One is the incubation period, that is nearly 4 weeks. The next one is the infectious stage, 4 stages of the skin rash. Okay, remember that? So first it will start with a pimple-like stage, then it will become a bigger one, and then it will become a pus will start from. That is called vesicle, second stage, and the pustule is the 3rd stage, it will come. Pus will be there. The 4th stage, it is going to heal. Once it is healed, crust will form, then no infection. Simple. Okay, so this is the take-home message. So what is the monkeypox? You know very well. Except the people, those who are highly risk. That means immunocompromised. So immunocompromised people, yes. So far, if you would have been seeing the Right. If you could see, globally, there is 78% of cases are male, and also the third bulletin, 98% of the cases identified as MSM cases, right? Of which 41% are HIV positive. Okay, so that means the WHO, what it says, 98% of the cases so far in the globally, out of that 41% were HIV positive. HIV positive means, yes, immunocompromised sometimes. And not only AIDS, but HIV also is immunocompromised, right? So like that, if you could take about, if the 100%, only 3 people died, that means it's a 0.01%. So that's why WHO says, even though it's a highly risk, but still we can control. So based on the data. Okay, sister?
Yes. Okay, so I think that was my one question for the day.
Right.
Are there any further questions? The online, definitely you're open to online viewers. Are there any questions?
Nobody.
Sorry, again, as usual, the technical difficulties are always a little bit jealous and need to pop in in these situations. Sorry, I'm trying to see the online persons, but I dropped out there for a moment. So just give me a moment. Okay. Anyway, we have run out of time anyhow, because we were supposed to end off this session, the hope for the next session. So again, I'd like to thank Dr. Singh for this very informative session. And we know that we can always ask him a question. We can rely on him to provide information for us when there's anything that comes up new. I'd like to also offer anyone who needs further clarification on the information that has been presented, you can contact myself, you can contact Ms. Cumberbatch, who's head of Port Health, or Dr. Singh, and if between Ms. Cumberbatch and I, we can forward any information to Dr. Singh, and any questions that we may need answered, and return them back to you. And other than that, thank you all for participating, and do have a wonderful day. Bye.
Thank you very much.
Yeah, so they come up pretty clear call. So let me know that you'll start in a moment. But remember, I can't do it. The camera's still on.
Yeah, I know.
All right. So we have the 3 o'clock people coming on.
Pardon?
We have the 3 o'clock people coming on.
No problem.
That some of our children coming on already.
For this session, anybody?
Oh, yeah, on both sides. So this is YouTube and this is Zoom. So they were on both.
Of course, as I said, it could get on YouTube, yes, it.
Yeah, but YouTube was on today, huh?
But YouTube was on with a different link.
Oh,
And it's there.
Yeah,
Both going on YouTube and
search for you would find it.
both YouTube and others.
of course, it's went on,
There were about 6 or 7 on Zoom. And how many were on YouTube? 17. We have
That's seven.
Yeah, we are ready when you are, hopefully the Wi-Fi doesn't drop again.
What happened? The Wi-Fi dropped out, so I couldn't see anything. So I was scrambling there for a moment. Oh, shit. Good afternoon, everyone, and welcome again to one of our sensitization sessions. Today we have Dr. Singh, and he's talking about monkeypox and everything that we should know about it. Just a little bit of housekeeping. Dr. Singh will do his presentation, and then you could ask any questions at the end of the presentation. You can type them in or raise your hand, and you will be acknowledged. So without further ado, I want to hand it over to Dr. Singh so he can make his presentation today. Dr. Singh.
Thank you very much, Sister Atlal Brathwaite. Along with me, Sister Cumberbatch, Port Health Senior Nurse, and also Pauletta Clark is the records officer is with us too. So the main objectives after this presentation, you should be able to understand what is monkeypox, describe the evolving of current monkeypox epidemic, state the possible local impacts of such an infection, outline the recommended responses. So monkeypox, what it is? What is monkeypox? Classically, is a zoonosis endemic to West and Central Africa since 1970s. That means it's a virus disease. Animal host, rodents, and other animals, including monkeys. Traditionally, from animal to human or limited family group outbreaks. Reporting rate apparently increasing since cessation of smallpox vaccine in 1980s. Exported infected animals caused outbreak in the United States in 2003. Human-to-human outbreaks in the United States, UK, Israel, and sea via infected travelers since 2017. In 2017 to present, Nigeria outbreak has more than 500 persons were infected. In May 2022, present multi-country outbreak in non-endemic countries, including Barbados. So the monkeypox virus, it is an enveloped double-stranded DNA orthopox virus, relatively stable genetically. Two clades, so one is Congo Basin and the other one is the West African. Congo Basin causes more severe disease, that is nearly 10.6% CFR, thought to be more transmissible. West African, milder disease, the CFR is 3.6%. So that means the Congo Basin virus, monkeypox, is severe and spreading fast. So this is the classical monkeypox stage, timeline, clinical findings, and infectivity. So mainly the incubation period is 5 to 21 days, nearly 4 weeks. And next it starts with fever stage, that is 1 to 4 days. Then rash stage, it takes 2 to 4 weeks. Finally, the recovery stage, it comes to days to weeks. So that means some people will get fast healing and some people will get slow healing. So finally they will be recovered. The clinical findings, fever stage, that is an anthem, lymphadenopathy near end. Macule, the rash stage is very important. Macule, papule, vesicle, and pustule. These 4 stages of the skin condition it will develop. Finally, it will end up into crusted and the healing process will start. So what about infectivity? Infectivity during the incubation period? No infectivity at all. Or fever stage, it is a very low infectivity. But whereas in the rash stage, it is very highly infective. So finally, once the rash stage, that is 2 to 4 weeks gone, then recovery stage will come, then everything will be no infectivity during the recovery stage. So monkeypox today, so this is the information from the United Kingdom. So we will see how it has developed there. In May 7th, in London, female returned from Nigeria. In 14th May, family of 3 no travel are linked to the case 1. On May 16 in London, 4 men who self-identify MSM unlinked to each other previous cases, that is on 16th May. On the 18th May in London, 2 men MSM via sexual health clinics were identified. In 21st May in London, New South Wales, 11 men unlinked to each other, links to London and Spain. On 23rd May, London, New South Wales, Scotland, 32 men, links to London and Spain. So this is the transmission. The transmission is close contact with symptomatic, that is, with lesions, body fluids, respiratory. Droplets or contaminated materials such as bedding, linen, and other things. Contact with infected animals. If animals are infected, yes, that has been contact with the human beings. Yes, spreads will be takes place there. Transplacental spread will be there too. Seminal fluid after resolution of lesions. Yes, that can be possible. Seminal fluid after resolution of lesions taking place. So monkeypox in skin and soft tissue. You can see that few poxes there from the A to H. You see that A, the first picture, yes, these pox are developing. And the second, you can see that in the palm and the sole and finger. Finger you can identify in the picture D. Very clear and very big pox. Single pox is there. And also then E, F, G, H. And you can see small pox and also the coming into the recovery stages also. So monkeypox in the multi-country outbreak. 1st of January to 7th of July 22, nearly 7,892 confirmed cases. Out of that, 3 deaths has been taken place. In 63 member states, in 5 WHO regions, 82%, 6,496 cases in 34 countries in the WHO European region. That means the European region is very high, 82%. Next is the 15%, 1,184 cases in 14 countries in the WHO Americas region, that is including Barbados. 2%, 173 cases in 8 countries in the WHO African region. Less than 1%, 24 countries in 24 cases in 4 countries in the Western Pacific region, and less than 1%, 15 cases in 3 countries in the Eastern Mediterranean region. So globally, 78% of cases were males aged 18 to 44 years, 7 children less than 18 years of age in countries in the Africa and European regions. 98% of the cases identified as men who have sex with men, that is the MSM group, of which 41% have HIV positive cases. 47% indicated exposure during social events with sexual contact. 113 healthcare workers included, checking if exposure is occupational. Non-typical presentation, few lesions or even a single lesion, no skin lesions in some cases, with anal pain and rectal bleeding, genital or perineal or perianal area lesions with no spread to rest of the body. Lesions appearing at different stages of development, asynchronous. Lesions before fever, malaise, and other symptomatic symptoms, absence of prodromal period. So you can see that the skin lesion after the day 5 from symptom, day 6, the onset of it is a macule, or we can call a small papule is there. Then next stage is going to 7th day, and also 9th day, and also 11th day. So that means the stages is starting from macules and papules, vesicle, and pustules. You can see that the third figure, you see that is a pus is started, that is a pustule state. And slowly the next slide you can, next picture you can see the crust is forming too. Once the crust formed, this total stage is 2 to 4 weeks. Then after 2 to 4 weeks, then slowly the crust is completely formed, pus will be disappeared, and no infectivity at all. So conclusion, monkeypox has likely been spreading globally since 2017. Spread can be accelerated in mass events that facilitate close contacts with multiple persons. Health workers interacting with the infected persons are at risk without standard precautions. So they were advised to use of appropriate PPE. Non-clinical presentation may facilitate non-isolation of infected and infectious persons. So implication, mass gatherings, festivals are possible super spreaders. Risk communication for participants needed. So that means in the mass gatherings, so we had to follow the protocols, same protocols we are following in COVID-19. The same protocols will be extended to monkeypox also, especially in the ports or when it is in the mass gatherings. So please follow the protocols. That means always try to use a mask and also sanitizers. Do sanitizers as much as possible. And if you have facility to wash your hands, please wash your hands frequently. And also the space, the distance space from person to person, that is always keep it in mind. That is 6 feet is always better, always. The healthcare workers to use standard and droplet precautions as warranted, because healthcare workers, whether they're in the ports or in the land side, sometimes they may not know who is the person. So in case if they identify signs and symptoms or rashes, immediately they can use personal protective equipment. So the simple thing too, especially PPE means personal protective equipment with mask and also the goggles and gloves. So these are all the personal protective. Immediately they can use it, and they can use it both in a surveillance side of ports and also inland side too. Implications: port assessment of the symptomatic traveler, health alert information. Especially this very important for the people, those who are working in the ports, assessment of the symptomatic traveler. If a traveler comes to Barbados to the shore or from the air side, then we have to immediately assess the person's symptoms. What are the symptoms? And then health alert information. These are all the 2 things very important, so that we can identify where is this person has came from, what is his background, how we got the any risk factors or anything to be immediately identified under close contacts. All these people will be assessed as early as possible. In the inland, index of suspicion for unusual rash, history of determine if probable case is a simple lesion, isolation, contact tracing is very important. Index of suspicion of STA rash. STA rash should probably also be tested for monkeypox, especially the STA clinics, sexually transmitted infectious clinics, STA clinics. In the STA clinics, generally, in the STA clinics, the healthcare workers are sensitized. So those who are coming to the STA clinics, if they get seen any rash or suspicious rash, immediately they can go for the monkeypox test also, so that is easy for the early identification and to control the monkeypox, especially anywhere in the ports, healthcare workers, if they could identify, or in the inland side, if they could identify, immediately you can call the healthcare institution or the polyclinic. Or if you know in the ports, you can call immediately port health nurse or port health, Bridgetown Port Clinic. You can call them and inform them such and such a person has suspicious about some rash. So immediately the port health officers, port health care workers, port health officers, immediately we will come and assess the person and see that in case if it is suspicious, we'll take a swab and we'll send them to our lab. So the result will be very soon. In case if you will find it at home, yes, if you see any person at home with signs and symptoms like a rash or fever or the lymphadenopathy or any other places, if you could see the lethargy, tiredness. So immediately you can call the healthcare institution or polyclinics, but don't take the person there. Keep the person in a isolation of some room in your home and call the people. Don't take the person to the clinics. So immediately the polyclinic or from the healthcare institution, they will advise you immediately, or they can send a team to assess this person at home itself. Or in the ports, we will assess them too. Then if it is suspicious, we take a swab and we'll send to the lab to identify if it is a monkeypox or not. If it is not a monkeypox, yes, you can be free, you can move around. If it is a monkeypox, yes. So we will inform to infectious disease control and inform to, that is Dr. Cody Ford and team and the chief medical officer and deputy chief medical officer. Everybody will be informed and they will take the decision where this person can be shifted to, designated place. And if it is a monkeypox, and they can decide it, they will send to them the isolated area for treatment. And after 2 to 4 weeks later, they'll be free. They can come back. So currently, we do not have any medication, only vaccination available. Currently, we do not have vaccination in Barbados, but very soon we may get it. Or otherwise, I can suggest you, but this vaccination is available in the New York, Chelsea STA clinic. Those who are, if they are traveling into New York, you can visit STA Chelsea clinic and you can get vaccination too. So in case in Barbados, if any person develops, we have an excellent team. They can manage, triage, manage treatment and send them symptomatic treatment and they'll send them back. So it is under control currently in Barbados. If you have, this is my, next one is my last slide. We got this information, all this information from PAHO, WHO, the experts and Bagani experts, TAT experts. These are all the research people. They're doing for the monkeypox and we are getting information from them. So might be in next sensitization meeting, if anything is updated, we will inform the update what is going on in the world, what is going on in the Barbados ports, also ports of entry too. So ladies and gentlemen, thank you very much for your time for listening this presentation. Thank you so much.
Thank you, Dr. Singh, and we are open for questions at the moment. So I will start the ball going. I like to ask questions that are asked of me for a lot of for clarification. So the first question is, how many days or weeks are you considered completely healed for the monkeypox, and should you be isolated for the entire period?
Okay, so I can go back to this slide. Right. You can see this slide, the timeline. The incubation period is currently, they say it is a 5 to 21 days from WHO. World Health Organization mentioned about that incubation period is 5 to 21 days. Then slowly starts with the fever stage. Fever stage is after 21 days, after incubation, it starts with 1 to 4 days fever stage. Once fever stage starts, then rash stage will come. Rash stage is 2 to 4 weeks. Okay. So fever stage is 1 to 4 days. Rash stage is 2 to 4 weeks. After 4th week, so recovery stage will start. So recovery stage means that is a crustule form. Pus will be totally disappeared and the pox will be cleared. So that means recovery stage. That recovery stage, sometimes the people will recover very fast and some people will take a little more time. It's depend upon the immunity of the individual persons. So that is not the big problem, but definitely it will be healed and the crust will go off. A whole scar will be slowly just started to disappear and no infection at all. So that is the stages.
Okay, so each stage follows one after the next.
That's right.
So it's only during the rash stage really that we are affected.
Yes, that's true. Highly infectious.
Fever and rash stage.
Yes,
Okay.
very highly.
All right, the next question, and if you can explain the term that you use for seminal fluid after resolution of lesions.
Right. So they mention is a question mark there too. Seminal fluid after resolution of lesions. Sometimes after the lesions disappeared, still might be seminal fluid might have that virus. Okay. So that's why that this is from the WHO. And if we get any more information about it, so in the next presentation, next sensitization, we'll give you very detailed about it. So that's why the Ministry of Health and the Senior Medical Officer of Health, Dr. Leslie Rolak and the team, when we are all prepared this the slides. So that's why we put question mark for seminal fluid after resolution of lesions. So that is still suspicious. They say that in some countries, yes, they are identified. So how far it is the scientifically the data? So that might be given in the next, when the report comes from WHO.
So the other question is, can you have monkeypox, which will be the lesions that where you identify it as monkeypox, but not have gone through any other stages or not have had any other symptoms?
I'll go back to the right. If you could come here, this slide, this outbreak 3, the last bulletin, lesions before fever, malaise, and other systematic symptoms, absence of prodromal period, that it can be possible. Yes, sometimes before the fever starts, you may see single pox or sometimes. That is a possibility. And a lot of times we ask the same question. Sometimes they may not see all the stages too. Suddenly pox will appear and it may show that is possibilities there too.
Okay. A question here is may ask, how do you know the difference between monkeypox and chickenpox?
Oh, that's monkeypox. It is only by the specimen we have to take it and send it to the lab. Lab will identify whether it is a monkeypox or chickenpox by the lab.
So only by lab work
Only
can we know the
lab,
difference.
yes, that is all. Sometimes we have to be very careful. Some of the chicken pox are big pox too. So that is a good question. We have seen some of in the ports also, we have found the huge pox, chicken pox in the forehead and other places too. So even that time, even we suspiciously looked at the gentleman, whether this is it a chicken pox or is smallpox. We know smallpox is not in the world, but it might be a monkeypox or some other pox. So chicken pox became very big. Yes, that is a very good question. But we can determine and identify through only by lab.
Okay. Now, this may sound like a funny question, but I still ask it. If once it's asked, I will ask it. Can you get monkeypox from monkeys?
From the monkey? No, not from the Barbadian monkeys, please. Barbadian monkeys are not infected. We are clearly mentioned that. Oh, hold on, I can go to the. Right. Here we can mention about this transmission, close contact with symptomatic with lesions, body fluids, respiratory droplets, contaminated materials such as bedding, linens, other thing. You can see the second bullet, contact with infected animals. These infected animals, those are only in the regions, in the African regions, right? Okay, and also you have to, in the same way, I will say that is two types of monkeypox, okay? One is two clades, one is a Congo Basin, next one is the West African. Congo Basin, you know that Congo is not only Congo, Democratic Republic of Congo, all the Congo Basin rivers and all those things. So all the places, some of the monkeys are infected too. Okay, rodents and monkeys infected too. So Congo Basin is severe disease. At the same time, West African countries, yes, Western countries in the rivers and all those places, this is the very mild case. Yes, definitely not Barbadian monkey, please. This is from the African, South African and the Congo.
So not our monkeys.
No, our monkeys are very safe, please. Thank you.
Okay. All right, so I think we are just about, not just, yeah, about out of time. If there are not any more questions, I would like to thank Dr. Singh again for his presentation and for giving us the knowledge and passing on the knowledge that he's attained. He's always very willing to help. He's been very gracious for the last 2 days to help us understand what we need to going forward. I also like to thank Ms. Cumberbatch, who was more spearheaded. I'm not sure what I'm here. She more spearheaded the organization of this than I did, but thank you so much. Also like to thank Mr. David Beckles for MIS. He's been great and keep me sane with all the glitches. So thank you everyone for attending, not only this session, but the last 2 days. And remember, if there are any further questions, you can pass it on to myself or Ms. Cumberbatch. And if we can't answer them, we relay them to Dr. Singh, and we surely will be able to answer them for you. And other than that, I'd like you to have a great evening, and thanks again for joining us.
Thank you
Bye.
very much.